British Columbia prepares to deploy its first dose of the AstraZeneca covishield to essential workers. Eagle News correspondent Kathleen Cruz reports.
British Columbia received the first doses of AstraZeneca covishield vaccines last week. The initial shipment of AstraZeneca serum will be used to protect workers in industries where outbreaks continue to occur.
And the first shipment that we received last week of this vaccine, about 60,000 doses, is being used right now to help us address community outbreak response. We knew that this was, in consultation with my colleagues in public health, using the vaccine to help break chains of transmission in communities, particularly where we are seeing ongoing risk and transmission in clusters and outbreaks in workplaces. These are the outbreaks that are happening now, and this helps us to reduce the transmission that we are seeing in our community right now. In the coming days, starting this past weekend, we are focusing on those high-risk work sites that we have identified through this pandemic as the ones where we see transmission, where it's very challenging for people to be able to maintain their personal protective equipment when barriers are an issue. And we've seen outbreaks that have affected communities around the province, particularly in food processing plants, in agricultural operations with shared accommodations.
Provincial Health Officer Dr. Bonnie Henry also mentioned that the additional vaccines from AstraZeneca are approved by Health Canada for people who are 18 years old and above. This is the third approved vaccine for use in Canada, despite suspension issues in some European countries due to safety concerns of blood clots to its recipients. As reported by Health Canada, the AZ vaccine will also be administered in 2 doses, with an effectiveness of 62% in preventing COVID-19 based on analyses conducted in Canada. By deploying the additional vaccines, BC will get ahead on its COVID-19 immunization plan to allocate the vaccines to priority and frontline workers and reduce COVID-19 transmission in BC. Alternatively, both Pfizer and Moderna are still being given based on age and vulnerable communities. The BC Immunization Committee is continuously reviewing data to determine additional workplaces that will be prioritized for immunization using AstraZeneca vaccine. In Vancouver, Kathleen Cruz, Eagle News. We live in interesting times.